Hi, my name is Dawn. I'm the founder of C.A.N.A, Caregivers Against Neglect and Abuse, and today I'd like to do a follow-up video on what to do after a stroke. I created this movement to support, educate, and spiritually uplift those who care for others, especially in the toughest season. So, last time we talked about the signs of a stroke, and we used the acronym FAST, F-A-S-T. So, today, like I said, I want to talk about what to expect after the stroke, and walk you through what happens after the stroke, what to expect, what changes, and how you can better care for your loved one or resident in this new chapter. Stroke recovery is not simply just a one-size-fits-all, and today I'd like to gently walk you through what happens after someone experiences a stroke, and every stroke is different, and so is every recovery. Severity and a location in the brain that the stroke occurred plays a major role in what part of the body that the stroke impacts. So, the first question is, what exactly is a stroke? A stroke is when blood flow to part of the brain is blocked or burst, causing brain cells to die. There are two common types of stroke. Ischemic clot. This is the most common type, caused by a blood clot blocking blood flow to the brain. Next is the hemorrhagic bleed. Not the greatest at pronouncing, but bear with me. This type involves a blood vessel bursting and bleeding into the brain. So what triggers stroke? Blood clots from injury, surgery, especially leg fractures, or even just immobility. Poor circulation or pre-existing conditions. Don't forget, we're going to quickly go back through FAST, the acronym FAST, just to remind us. Remember the signs of the stroke. F is face, is it drooping? A, arms. Can the person lift both arms? Speech. Is their speech slurring? Does their voice sound odd? T. If you said yes to any of these, it's T, time to act. Stroke is a medical emergency. Immediately call 911. Know the warning signs, take action early. When the individual does have a stroke, it either occurs in the right side of the brain or the left side of the brain. If the right side of the brain is affected, the left side of the body is weakened or paralyzed. If the left side of the brain is affected, the right side of the body is weakened or paralyzed. This determines what daily functions are impacted. Some may become nonverbal. Others speak but are hard to understand due to aphasia. Remember, this is not a loss of intelligence, but damage to the communication center. This means that signaling from the brain to move the mouth to form the words, that signaling is damaged and is not functioning properly. Sometimes when you ask your loved one a question, and the person may comprehend and know what the answer is, but the mouth cannot form the words to answer, and most times it just results in somebody not even attempting to verbalize anything, or very few words at all in this case because of aggravation. A stroke can be an instantaneous, life-changing event. A person going from a total independent life to all of a sudden total dependency. They may not be able to stand or move as before. They may now need help getting dressed. In this case, a tip. when it comes to dressing the upper body, dress the affected side first. Person may now need full assistance using the bathroom. Incontinence is common after a stroke. Brain communication is not properly functioning, signals damaged in this case. Remember, the person is not losing bowel function or bladder function on purpose to aggravate you. The body is not functioning as it should. A stroke can cause changes in eating, drinking, and appetite decrease as well. Swallowing issues can rise. Choking while drinking, chewing food more difficult. Sometimes in cases such as this, pocketing food in the cheek can and will occur. May need feeding help. May need food texture changes. So, what happens to the swallowing muscles? A stroke can weaken or paralyze the muscles in the mouth, the throat, and tongue, making it hard to chew or swallow properly. Remember, if a person you are feeding starts choking and the food flies out of their mouth on you, this is not done intentionally. The brain communicates, the brain's communication to the muscles is interrupted as a result of the stroke. The body does not time the swallowing maneuver muscles properly and as quickly as they should. And as a result, food or drink may go down the wrong way into the airway, trachea, instead of the esophagus as it should. Choking is when food is stuck in the throat. Aspiration is when food or fluid enters into the lungs. If unnoticed, aspiration can cause pneumonia, especially in the elderly or the ones who are immobile. Signs: you may need to change food texture, coughing, clearing throat while eating or drinking, wet gurgle voice after swallowing, taking a long time to chew or swallow, pocketing food in cheeks, refusal to eat due to fear of choking. If you notice sudden fever with no known cause, this could be a sign of aspiration. If you are at home caring for your loved one and have not already, you should contact a speech therapist. A speech language pathologist is trained to assess and treat swallowing problems if choking and coughing or trouble eating is occurring after a stroke. They can perform swallowing evaluation and recommend safer ways to eat. They may recommend pureed food, thickened liquids. They will teach safe swallowing techniques, and they will help to rebuild muscle control through exercises. Remember, eating and drinking may seem simple, but after a stroke, it can become dangerous without the right support. Watching for signs, adjusting food texture, and contacting a speech therapist early can prevent serious complications. Fall risk and bed safety. Stroke survivors fall more often. Tips: use safety mats by their bedside. If at home, use anything to cushion if a fall were to occur. And place those on the side of the bed that the individual typically gets up to get out of bed to go to the bathroom. Falls often will occur after a stroke because when a person is sleeping, they may instantly get up and not remember that they've had a stroke and try to move their body as they normally would. And as they start to move, the body is still not able to move because of the stroke. And oftentimes, that is a major cause of falls as a result of after a stroke in the middle of the night. If possible, lower the bed. Always keep frequently used items near their bed and within reach. Water always in reach. Give them plenty of fluids to drink. Dehydration is a major problem in individuals who are stroke victims. Urinal in reach if applicable. If necessary, bedside commode. If person is not able to get up to use these items to relieve themselves, use a bedpan. If using a bedpan is necessary, keep in mind 15 minutes. That person should sit on the bedpan, no longer if possible. Breakdown injuries from pressure can and will occur, which leads to even bigger problems. If you are at home and have no experience with using a bedpan, I will have an additional video created just for bedpan teaching. I will share in that video some very important tips with you and keeping preventatives for infections for them and hygiene tips for yourself. Remember, kindness and skill go hand in hand when it comes to caregiving. What you do and how you approach matters. Ensure bed alarms or motion sensors in place if available. If you are at home, use baby monitors if possible to help to keep an eye on the person when in another part of the home. Now I would like to get into lack of movement of the arms and legs after a stroke. Educate on contractures and preventatives. Without movement, muscles shrink and tighten. These are called contractures. This will permanently freeze your joints if it's not addressed early. Contractures can be extremely painful. Contractures can begin quietly. Prevention is key. So, what does quietly mean? At first, there may be no pain, no signs of pain in the person. Redness or clear deformities, there may be absolutely no signs. The limb may just seem a little stiff or harder to move. Caregivers might assume the person is just tired or refusing to move, but in reality, the muscles are already starting to tighten. If daily range of motion exercises are not started quickly, the joints begin to curl inward, freeze in place, and become very painful later. So why is this important knowledge for stroke care? Is often contractures go unnoticed in first days or weeks following the stroke, especially when our focus is on the recovery, the speech, or feeding. But if left alone, they set in silently and become permanent in a very short amount of time. So you may not notice it at first. Maybe their hand is not opened, they keep it clenched, or their arm is bent, drawn up toward them more and more. They hold their arm in this manner. This is a sign of a contracture. The exercise is a must-know to prevent permanent contractures or worsening. I will have a separate video for the teaching of these very important exercises of the range of motion. I will walk you through them, and I will also include on the Facebook group page a visual pamphlet of the exercises. So that way you can help your loved one and prevent these painful experiences if at all possible. Recovery is hard, but it's not hopeless. Caregivers know that your role is sacred and life-giving. And remember, the Bible reads, "A king shall answer and say unto them, Verily I say unto you, inasmuch as ye have done it unto the least of these, my brethren, ye have done it unto me." This verse shows that every act of care given to another is seen by God as if it were given directly to Christ himself. That is what makes caregiving sacred. Bear ye one another's burdens and so fulfill the law of Christ, which is to love one another. So caregiving is literally fulfilling the law of love. Caregiving is not just a task, it is a calling. It is sacred. It is life-giving. When we serve others, we serve Christ himself. Thank you for what you do. Thank you so much for listening. Audience, it is now time for you to chime in. If you have experience in caring for a stroke victim at home or in a facility, and you might have some advice you'd like to share, feel free to drop your advice in the comments. Or if you are an individual whom has experienced firsthand some of these things and that I have described and would like to share, by all means, do so. So your experiences may help to encourage another. Again, my name is Dawn. Thank you for watching.